Hi everybody, this is Mrs. Poindexter and we are going to be going over respiratory disorders part 1. We're going to be talking about the upper respiratory disorders, and again this will relate to the Honan chapter 9 and ATI chapter 20. So upper respiratory disorders we're going to talk about rhinitis, rhinosinusitis, pharyngitis, laryngitis, and influenza or the flu. So rhinitis, remember I told you that this is the common cold. It's typically viral. It's an inflammation of the nasal mucosa. Symptoms usually last 1 to 2 weeks. Remember, transmission is by droplets, so within 2 to 3 feet from a person. So if you have a patient that is being treated in the hospital, please make sure you are wearing the proper PPE. Symptoms: sneezing, coughing, some watery eyes, low-grade fever, and like I said, a lot of these upper respiratory disorders are really going to cross over, so understand that that really is not something that you're going to be tested on, but you should at least understand some of the symptoms. And do also know that sometimes it can coexist with other disorders like asthma or allergies. Time of year, higher rates obviously when school goes back into session and the winter into spring months. Again, viral symptoms usually last 10 days, 1 to 2 weeks. Anything beyond that, and if the symptoms seem to worsen, there is the possibility of a bacterial infection. And if a physician does determine that it is bacterial, they will probably start a course of broad-spectrum antibiotics. And remember, as a nurse, part of your teaching points is to make sure that the patient completes the course. So most of the population has been exposed to the herpes simplex virus 1 or HSV1. So individuals who have exposure to this virus, it lies dormant in the system and kind of gets aggravated when there is a cold. Nursing care education. This is going to be vital for you to know and understand. So rest, fluids, home humidifier, proper disposal of tissues, hand hygiene, how to cough, limit your exposure to others. Complementary therapies can seem to help promote the immune response. And I also kind of lump as part of this the over-the-counter meds that patients typically like to use to try to treat the symptoms. So you have to kind of remember that with rhinitis, with it being caused by a virus, that these medications aren't meant to, they're not antivirals. So really it's just managing the symptoms that is caused by the virus. Sinusitis, or is known as rhinosinusitis, is going to be the inflammation of the mucosa membranes and one of the sinuses. It could be either the maxillary or the frontal. It can typically involve in causing a sinus infection just because of the swelling of the mucosa that blocks the drainage of secretions. And when there is a blockage, like I showed in class, it just, with the narrow passageway, it just becomes a frenzy or just a great area for bacteria to grow and be nurtured. Symptoms are a lot like rhinitis, plus you might have additional facial pressure, pain when head is tilted, can have some bloody or purulent nasal drainage, tenderness when palpating the forehead, orbital, and facial areas. And really the true way to see if there's a sinus infection is going to be a CT or a sinus x-ray. Nursing care, it's going to be the same as rhinitis, plus discourage air travel, swimming, or diving, just because the pressure changes will make the pain worse. Tell them to stop smoking, any form, and nasal irrigation and proper use of nasal sprays. A lot of times using the irrigation and nasal spray, it has salt in it, and it's a medical grade salt, not like your table salt. That is used, and the salt actually helps kind of shrink the swollen tissue and helps promote the nasal passages and making them wider. Sinusitis, some medications that are used, nasal decongestants. It constricts the blood vessels and helps decrease some of that swelling. Again, remind your patients that it's short-term use to avoid rebound nasal congestion. So using it too much can actually make the swelling worse. And really, it needs to be used at the first signs of symptoms. Pain relief for the pressure can be NSAIDs, Tylenol or aspirin. And of course, if there's a suspicion that there is an actual infection, that using a broad-spectrum antibiotic will help. Other things, sinus irrigation, like I mentioned on the last slide. And further education is to instruct the patient to contact their primary care provider if they start noticing a severe headache, any kind of neck stiffness, which is known as nuchal rigidity, and a high fever. What may have possibly happened in this case is that the pathogens have entered the bloodstream from the sinus cavity and can cause either meningitis or encephalitis. Pharyngitis is going to be your inflammation of the pharynx. In terms of signs and symptoms, it's going to look fiery red when you look in the back of a person's throat, of the pharyngeal membrane and tonsils. You're going to have swollen lip nodes. There might be some exudate coming out of the tonsils if somebody still has them. They are typically going to have a fever, just feel down and have a sore throat. And really the cause is going to be management is going to be based on the cause. Laryngitis, this is basically an inflammation of the larynx, and people typically will lose their voice. There will be a severe dry cough, sore throat. Onset is usually sudden. It can be aggravated by cold, dry wind. The throat feels worse in the morning and seems to improve when a patient is indoors in warmer climate and worsen as the evening comes. They may describe that they have a tickle in their throat that's made worse by cold air or liquids. And some folks can have chronic laryngitis, and this will be seen with a persistent hoarseness. And again, some of that medical management is going to rest the voice, avoid any kind of irritants like smoking, rest, and inhaling cool steam. So influenza, we're all very aware of this. It's the flu. It is seasonal. It seems to become predominant in the fall and winter months. It is highly contagious by droplets from sneezing, coughing, and direct touch. The big problem and why it is so contagious is that adults are contagious from 24 hours before manifestations, so any symptoms show, and can last up to 5 days after they begin. So just imagine that if somebody gets the virus, that they are contagious for about a week. Manifestations, headache, chills, fatigue, diarrhea and cough. That's going to be more in line with the avian flu, and fever. Medical management, antivirals like Tamiflu within 24 to 48 hours on the onset of symptoms. After this, they are not as effective. A big issue with taking something like Tamiflu, and you want to know it as oseltamivir, is that it can cause some severe GI upset and vomiting. Most individuals who have taken Tamiflu anecdotally say that they much rather deal with the symptoms of the flu than the side effects of Tamiflu. Nursing management, droplet precautions if you have a patient. Monitor hydration, just because if you think about fever and sweating, they're going to be a high risk for dehydration. Obviously, prevention is best. Washing hands, cough and sneeze etiquette, getting vaccinated, either the IM or nasal spray. And the big complications are going to be pneumonia and dehydration. So you have to think about those that are going to be at higher risk, going to be our young folk, babies 6 months of age and older, those with a history of pneumonia, chronic medical conditions, pregnant, over the age of 65, and healthcare providers. So when we talk about the actual vaccinations, the injectable is made from the dead influenza virus, is recommended for those 6 months and older. Those who are getting their first vaccination and are between 6 months and 8 years old need to have 2 rounds of the shot. The second one needs to be at least within 4 weeks. You should get it done by the end of October, before the flu season actually is in full swing, just because it will take about 2 weeks for the vaccination to be effective. Those who choose to have the take it nasally, it's actually made by weakened influenza virus, is only recommended for those between ages of 2 and 8 when they're getting their first dose. They'll also need 2 doses. It is only for individuals between 2 years and 49 years who are in good health and are not pregnant. Side effects are minor, but a lot of times they can be worse than the injectable. Facts about both: it takes 2 weeks to be effective, should be avoided in those that have had a severe reaction in the past. If somebody does have an egg allergy, because the vaccination is made with a small amount of egg protein, if someone says they have an egg allergy but they just get hives, they can actually still have the vaccination, and it should only be avoided in those that have a severe allergic reaction to eggs. Medications for upper respiratory infections. Make sure you're familiar with the different classes: antihistamine, decongestants, antitussives, and expirants, and know some of the examples. Make sure you know the generic name. On test, I will give you both. Now let's talk about trauma obstruction of the upper respiratory airway. So we're going to talk about obstructive sleep apnea. You might also hear it known as OSA, and epistaxis, which is also a nosebleed. Points that you really need to understand about obstructive sleep apnea is what is defined as OSA. Is going to be presence of at least 5 obstructive events per hour during sleep, and each event lasts up to 10 seconds. Complications, make sure you're aware of that. Usually with those with hypertension, and if they have that, it puts them at a greater risk for MI, stroke, and death. Risk factors: they've already had a history of CAD, heart failure, metabolic syndrome, and type 2 diabetics are going to be at risk for OSA. And that really has a lot to do with other things with that individual, whether they're already overweight and having a sedentary lifestyle. Men who are older and overweight have some physical structure changes, and those with low muscle tone are also going to be at risk. So you see this individual with, you just have to imagine with this extra weight here, putting pressure can cause an obstruction when they sleep. List of signs and symptoms, as I mentioned in class, that as you go down these symptoms here, you can tell that the symptoms are worsening, and that has a lot to do with how long somebody is actually experiencing OSA in their life. So a lot of these earlier symptoms will be earlier on in a person's life, and as it progresses, you will see how it is affecting both heart and lungs. Link between heart disease and OSA, I'll go ahead and read this. When you stop breathing, your oxygen level drops, and your body responds by releasing epinephrine, or as we know it as adrenaline, which is a stress hormone. And when this happens over and over, adrenaline levels remain high, and this can lead to high blood pressure. We see that with a sleep disorder found in 47 to 83% of people with cardiovascular disease, 35% of people with high blood pressure, and 12 to 53% of people with heart failure, atrial fib, and stroke. So researchers estimate that untreated sleep apnea may raise the risk of dying from a heart disease by up to 5 times. So if you have patients that already have some heart and lung problems going on, it would probably benefit them to do a little bit more assessment and questioning in terms of, daytime sleepiness. If they snore, they may have undiagnosed OSA, and it should be further investigated. Ways to manage it depends a little bit on the cause. If it is weight related, sometimes losing weight can help. Avoiding alcohol and hypnotic medications because of how it will relax the muscles in the throat and lead to an obstruction. Sometimes oral appliances can be used that will reposition the mandible or tongue. So basically what's happening, if somebody's asleep, that the tongue kind of slides back and causes an obstruction. Ways to treat it: non-invasive positive pressure ventilation most commonly is used as a CPAP. The big thing about a CPAP is that it's only to be used with patients that can breathe independently. Those who may have some pulmonary issues with either central sleep apnea or severe COPD will need a BiPAP machine, and this is used for patients who may require some ventilator assistance at night. So basically, if somebody already is struggling to breathe, they probably need a BiPAP machine. Some other management for it, surgery. Again, it kind of depends on if they can get to an etiology of what is causing the obstruction. So a person might have a tonsillectomy or the UPPP or nasal septoplasty. Pharmacological therapies. This is going to, the 2 medications here, Provigil helps reduce daytime sleepiness, and this medication is also sometimes used with people who work swing shifts. Triptyl, that is to be given at bedtime, and it can help increase the respiratory drive and improve upper airway muscle tone. And the big thing that nurses can play when they have a patient with OSA and they're either using a CPAP or BiPAP is really encourage their compliance of using it every night. If somebody doesn't understand that not using their machine could possibly put them at a greater risk for heart attack, their compliance is going to be low. So you really need to make sure that they fully understand why they're using the apparatuses they are to help. And you can also let them know, say, hey, it will help you get a better night's sleep too, especially if you have patients who complain about daytime sleepiness. It may be because they're non-compliant, but also what can happen over time if they're not seeing their physician who first set up the CPAP machine, that they may need an adjustment in the actual pressure. So they would have to do another sleep study. So let's talk about nosebleeds. Basically, it's a hemorrhage from the nose. You really don't need to know all these risk factors, but just know that they do exist and that different either infections all the way to different diseases, use of aspirin, or like with hypertension can cause them, or unfortunately just blowing your nose way too hard as well. Make sure you can teach somebody the proper way to manage it by pinching the outer portion of the nose and leaning forward for 5 to 10 minutes. Also, once they get it under control, talk to them about ways to prevent it. Laryngeal cancer, only things you need to know about this is that the most common symptom is hoarseness. Medical intervention is usually surgery of a total laryngectomy. So when that is done, that the patient loses their natural voice. And in this case, they'll have a tracheostomy. Nursing care, you want to keep it semi-Fowlers to decrease edema. A humidifier. If there is respiratory distress, O2 must be delivered through the stoma. And if deep suctioning is done, sterile technique is required. So let's just, before we wrap things up, check some of your understanding. So, what is the use of an expirant? Help to bring up mucus and other material up from the lungs and trachea. Antihistamines. For allergic inflammation reaction like runny eyes, nose, and congestion. Antitussive is a cough suppressant. And decongestant is to relieve nasal congestion. Which one applies when we talk about vaccinations for the flu given to those 6 months and older? I hope you said the injection. 2 doses required for those without previous vaccination exposure. I hope you said both. Given to those between 2 years and 49 years old. Nasal. Pregnant women can have injection made with weak viral material. Nasal, and can be given to those with a mild egg allergy. I hope you said both. Symptom management of the common cold, like we did in class, make sure that you can list about 8 different symptom management, and not just symptom management, but advice that you can give to a patient to basically help prevent the spread of the common cold, which, what is the common cold also known as? I hope you said rhinitis. So I'll give you a few moments if you want to pause this before we go over these to see if you can write them down. Number 1, hand hygiene. Number 2, rest. Number 3, increase fluids. Number 4, home humidifier. Number 5, proper disposal of tissue. Number 6, how to cough. Number 7, limited exposure to others. And our last one, over-the-counter meds. And this also applies to complementary therapies like echinacea and high doses of vitamin C that have been shown to perhaps stimulate the immune system. Droplet precautions. What do you wear? Do you wear a mask with an eye shield? Yes. Do you wear gloves? Of course. Gown? You betcha. Respirator? Oh no. Respirator should be used with those with airborne precautions like tuberculosis. So let's talk about donning and doffing your PPE for droplet precautions. What is the first thing you're going to put on? I hope you said your gown. Next step, your mask with face shield. And lastly, make sure you put on your gloves. Now the best way to take off everything with droplet precautions is kind of a technique where you're going to take your hands and pull forward at the top of your gown, so you can kind of do a rolling motion where you tuck in the gown towards kind of like your stomach, where you're taking off the gloves, so you can kind of roll it up in a ball without touching the outside. Once you've done that and have properly disposed of it, then take off your mask and face shield. If you have any questions about any of this, please feel free to email me, post on a discussion board before the test, or stop by and see me. I hope this was helpful. Take care.